Well, good morning, and thanks for attending today, and we apologize for the technical difficulties. I'm joined by Louise Gagné, Executive Director of Community Services, and she's going to provide an update on the local COVID-19 situation. And Andrea McLellan, Director of COVID-19 Immunization Strategy, will speak about our vaccine rollout. Over the past week, we as a province have had to pivot. COVID-19 cases have reached record high numbers, with daily totals above 4,000 cases. As of April 6, variants of concern make up over 65% of all cases across the province, and these VOCs spread 50 to 70% more easily. The majority of these cases are originating from Southern Ontario. Although our numbers are still some of the lowest in the province, our case count for the first half of April has almost surpassed our total case count for March. And we're seeing an increase of cases with unknown community exposure, meaning people are getting the disease and don't know where they got it from. We must remember our province is still under a stay-at-home order, meaning everyone must stay at home and only leave for essential trips. It is up to each one of us to do our part to keep up the hard work and dedication so everyone stays safe. And I recognize the financial, emotional, and mental stress this has on people, which is even harder with the announcement of online learning starting April 19th. The best way for our students to get back into classrooms is by ensuring we have low community spread. That is something that we can control. But we have to remember, we're not an island. We need to work together as a province and as communities to slow the spread of the virus so we can get our children back in school as soon as possible. We have proven throughout this pandemic that when we follow public health measures together, we can keep ourselves and our loved ones safe. With that, I'd like to hand it over to Ms. Gagné to provide an update on our local COVID-19 situation.
Thank you, Dr. Chirico. In the last 7 days, we have had 14 cases, bringing our total case count to 324, with 214 in the Nipissing district and 110 in the district of Parry Sound. As of this morning, we have 21 active cases, with 1 case in hospital. To date in April, today being April 15th, we have seen 29 cases in our district, compared to 30 cases for the entire month of March. Many of these cases, as Dr. Chirico said, are categorized as having an unknown exposure, meaning that the case does not know where they acquired their disease. This is evidence of increasing community spread within our district. On Tuesday, we launched our COVID-19 status report, an interactive dashboard where the public can find up-to-date local COVID-19 data and see trends. The health unit is no longer providing record level data on our website. We are instead showing age group, possible exposure, and current status of COVID-19 cases in an aggregate format. For detailed record level data, you can still access this from the Ontario website. As Dr. Chirico previously mentioned, on Monday, the province announced that all publicly funded schools across the province will start online learning as of April 19th. The province has not indicated how long this shift will be, but did say that these measures will be in place until a decrease in COVID-19 cases is observed, and when the province feels it is safe to return to in-person learning. We know how important it is for students to return to in-person learning, not just for the students, but also for parents and guardians trying to continue to work. We will advocate for a return to in-person learning for students in our district once the provincial COVID-19 situation starts to improve. With that, I will pass it back to Dr. Chirico.
Thank you, Ms. Gagné. And now to Andrea McLellan to give an update on our vaccine rollout.
Thanks, Dr. Chirico. Good morning, everyone. As of yesterday at 3 p.m., we have provided a total of 29,697 vaccinations in our district. This is a pivotal moment for our communities as 26.85% of individuals 18 years of age and older in our district have received their first dose of COVID-19 vaccine. But this does not mean that we can relax. People who have received the vaccine still are required to follow public health measures. The provincial vaccination plan is trying to provide as many people with at least one dose of vaccine in the shortest amount of time. Though the partial vaccination of a growing segment of the population does reduce the risk of spread, it doesn't eliminate it, especially when there are high numbers of cases in the population. Vaccines don't provide perfect protection, and there is still a risk of spread of COVID-19 by and to individuals who have received one or even both doses of the vaccine. We continue to follow the provincial direction for vaccine rollout within our district. However, demand for the vaccine in our community continues to exceed our supply, and we understand that's frustrating. We have opened additional clinics across the district based on the vaccine supply we are receiving. Planning is underway to provide immunizations to some of our most vulnerable populations, including homebound and chronic home care recipients, those in congregate care settings and shelters, as well as individuals undergoing active cancer treatment and organ transplant recipients. Our call centers continue to experience high call volumes. If you do require assistance booking your appointment, the Health Unit's call center is available, but please be patient. If you're able to book your own appointment online, we would encourage you to do so. If you wish to book an appointment for a vaccine at a pharmacy, please contact the pharmacy directly. The Health Unit does not book these appointments. And now I'll turn it back over to Dr. Chirico.
Thank you, Ms. McLellan. So this concludes our remarks, and we'll begin answering questions. So if you have a question, please type them into the Q&A at the top of the screen. Our moderator will read them out loud, and we'll try to cover off as many as we can. And when possible, please ensure your name is attached to the question. So Alex, I'll turn it over to you.
Thank you. Our first question comes from Alana Pickrell at CTV News, and this is directed towards Dr. Chirico. There was a recent tweet from Public Health Sudbury Districts thanking the Health Unit, the North Bay Parry Sound District Health Unit, for its support. How is the Health Unit helping?
Well, thank you for that question. Because there were so many cases, sometimes they happen all at once. So it's very difficult to get all the cases followed up by public health. And so we all work together as health units, and especially in the north, we have regular communication. So what we do is we connect with each other if somebody needs help. So what that help is that when they have a lot of cases, we want to get to them quickly. So our communicable disease control staff will follow up with cases in their district and get all the information that we would do here, and so that they get a phone call as quickly as possible, get instructions with regards to what they have to do, and answer any questions that they have.
Thank you. Our next question is for Louise. It comes from Greg Bowman at Moose FM. Given the low local numbers and the low transmission levels in schools thus far, do you think the Health Unit should be able to make the decision on schools rather than the province?
The Health Unit does recognize that in-person learning is the ideal situation for most students, and as well for their parents and guardians. The situation, though, that we're experiencing across the province has escalated to a point where the province felt that it needed to make a necessary and important decision to close schools across the province, in addition to implementing the stay-at-home order. The goal is to reduce the movement of people within the community and subsequently reduce the spread of COVID-19. In circumstances like this, the province needs to play a role in protecting and moving towards reducing the spread of COVID-19 across the province. When the time comes, local authorities will be consulted and we will be able to advocate to return to in-person learning.
And I'd like to add to that too, in that I think that it's very, very important for the public to realize that the quickest way to get back to school, as we've said, is to ensure that we all follow public health measures so that we can keep the spread of the virus low in community. The biggest risk to the schools is if we have high case numbers in our community. And that's something we can control and work to lessen. So we will follow the province's direction, but there's lots we can do locally to ensure that we can get back to school quickly.
Thank you. So we've had 3 questions that are similar from 3 reporters. So I'm going to read them all off and they will be directed towards Dr. Chirico. So Alana Pickrell, is there any comment on reports of a local family with a disabled family member who had to book out of district to get a vaccine since they couldn't get one in North Bay? Similar question from Clark from Your TV. Good morning. My question is regarding the local reports of a family with a high-risk individual that was unable to receive vaccine in a timely manner in our district. So the family traveled outside of our district to receive the vaccine. What efforts are being made moving forward to ensure that local citizens do not have to travel outside of the district to get vaccinated? And then the last on the same topic comes from Chris Dawson from Bay Today. One family with a chronic home healthcare son is getting their son vaccinated in Sudbury. They say it's because they were skipped over here. How and why did that happen?
Well, I certainly thank you for those questions, and I certainly understand people's frustration, families' frustration with regards to it. The simple fact is that there is a significant demand for vaccine, and we have a very limited supply. And I know it's frustrating for everybody, and everybody that wants to get a vaccine will get a vaccine. We just must be patient. We are inundated on a daily basis with requests from individuals, from groups, from families, that they should be ahead of other people. We recognize that in many cases, they have very legitimate reasons, but we have to follow an ethical framework that's set out by the province and follow it in order. And the demand is, again, it certainly exceeds the supply that we're getting. So what are we doing about it? We are advocating to get more vaccine for our district. However, we also have to recognize too that this third wave has evolved significantly and that there are significant changes that have occurred recently. The healthcare system, especially in Southern Ontario, is becoming overrun. ICU patients are becoming more and more ill, requiring ventilation. They're in a situation now where they're having to transfer patients. So there are significant hotspots in Southern Ontario, and vaccine has to be allocated to areas where it is most needed. So I understand people's frustrations. They have to be patient, and we have to follow the protocols that we have in place. Eventually, we will get to them, and we have a plan. And as the vaccine gets rolled out, they will get vaccinated.
I can add to that as well, Dr. Chirico. As far as how are we going to prevent this from happening, we're working to get through the phases that have been rolled out by the ministry. Currently, we have a plan that is being implemented this week to contact all home care recipients who are on the list that we've been provided with to provide them an appointment for vaccination. Our homebound home care patients are in the process of currently being immunized as part of a partnership with the community paramedics in both Parry Sound, in the West Parry Sound, East Parry Sound, and North Bay areas. So we're working on that, and we're working on some plans to immunize some of our other very vulnerable populations, such as those in shelters and the homeless, and plan to roll that out very shortly as well. And so we recognize that those are important populations. As Dr. Chirico said, our vaccine supply has not necessarily kept up with the phases that have been rolling out, and we're doing the best that we can to get it out to those populations. And so there will be more information coming to those individuals and families that are impacted in those groups.
Thank you. Our next question is for Andrea. It comes from Jennifer from the Nugget. Have any AstraZeneca vaccines been administered locally, and whether those who have or will receive it have been asked to monitor in any special way for issues?
Hi, Jennifer. Thanks for that call, or sorry, that question. We at the health unit have not received a supply of AstraZeneca to administer. The local pharmacies that are involved in the rollout of AstraZeneca have the vaccine and have been administering it, but we don't know what their volume of vaccine that they receive or what their what the uptake has been like. The pharmacies are managed directly by the province, the same way that the flu vaccine is managed. So it's distributed to them and they report back to the ministry, not to the health unit. So I'm not aware of any information with respect to that. That would be a great question to ask the pharmacies that are involved.
Thank you. Our next question comes from Sarah Cook from the Parry Sound North Star. It's directed towards Louise. Why is the health unit giving less information about individual COVID-19 cases on the website? What spurred the decision to change the COVID-19 change to the dashboard and no longer provide record level data?
Thanks for that question. So the record level data is still available on the Ontario website. So we're just removing that duplication of effort. And really, we are at the stage now within the pandemic where we need to be looking not necessarily at individual cases, but more at the trends. And that is what we have been using internally at the health unit for since the beginning to drive decisions and inform decisions. And so we felt that it was the right time now that we're seeing this exponential peak in the province to share this data with the public, and so that they can see age groups that are most impacted and then the rise in cases over time.
Thank you. Now, once again, we have two questions that are similar and they're directed towards Dr. Chirico, so I'm just going to read them both out. The first is from Chris Dawson from Bay Today. What is your opinion on curfew to help curb the spread? And from Jennifer from the Nugget. There is talk about the province enforcing further restrictions. Do you support enhancements like curfews in the North Bay Parry Sound District?
At this time, I think that what we have in place, if people follow what we have in place, there wouldn't be a need to get to that situation. Nobody wants curfews to happen. But if things get so far out of control, and again, I want to emphasize that we now have an opportunity to put measures in place, and as individuals, if we follow them, we won't get to a situation where, as we've seen in Quebec, curfews have been put in place. Curfews have had some success in some countries that have used them, and again, it's an extreme measure, but if things get so bad that our healthcare system becomes so overrun that they have to be put in place and people aren't using good judgment, the government may be forced into having to do that. So nobody wants it, and we have an opportunity to prevent that from happening by following the public health measures so that we can reduce our cases and get back to a normal existence.
Thank you. Now, our next question is also for you, Dr. Chirico, and it comes from Alana Pickrell from CTV News. Any reaction to the planned protests this weekend?
Again, we've seen this in the past, and I think it's really unfortunate that that occurs. I think by openly defying what's in place to help keep everybody safe is putting everybody at risk. And I feel it's very irresponsible when they're not physically distancing and when they're not using face coverings. You can protest, but adhere to the gathering limits, adhere to the rules, adhere to the public health measures to keep people safe. And so I hope that they reconsider and I hope that they don't put anybody at risk.
Thank you. This question is for Louise. It comes from Jennifer from the Nugget. The health unit has been vocal in their stance in keeping kids in school. Exactly what has to happen in order for the health unit to advocate to get kids back in school?
Thanks, Jennifer. Yes, we have been strongly advocating for this throughout the pandemic, as we do feel that it is very important. Even when we had higher restrictions earlier in the pandemic, we were able to maintain our children with in-person learning. As I've stated before, the situation is like nothing we've seen before in the province. And we need to be working together across the province in order to prevent and slow the spread of COVID-19. As Dr. Chirico mentioned earlier, and in my case update, we are seeing more and more community spread even within our own district, where people are not sure where they acquired the disease from. And we need to keep the community transmission low in order to keep our schools open. So when the situation starts to improve, which the province and the health units are monitoring on a daily basis, I'm sure that there will be an opportunity to look at this issue again, and local evidence will be used to inform whether or not it's safe to open schools within a particular district. We just need to be patient.
And I'd like to further add that it's not going to be one indice or one indicator that will determine it. We have to take so many other factors into play and analyze them. And it's not just within our district too. Our district numbers may be low, but we have to be very aware of what's happening provincially and what's happening to neighboring health units. We have to look at the trends and look at the public health system capacity. We have to look at school capacities. We have to look at the acute care capacity in our intensive care units, our hospitals. So there's many factors involved, and it will be ultimately up to the province to make the decision of when they feel it's safe to open. And that's something that we all have an opportunity to influence by keeping our numbers low in our district, by following the public health measures.
Thank you. Our next question is from Sarah Cook from the Parry Sound North Star. It's directed towards Andrea. Are there places in Almaguin to get vaccinated? Will there be a health unit push on the province to get people in this larger geographical area covered, or do they have to travel to North Bay, Parry Sound, or Huntsville?
We offer clinics currently on a weekly basis in Sundridge to the Almaguin area. And we've also been working with community paramedics to support those people in that area who are unable to potentially come to our clinics, so the homebound individuals who are in that district, so they don't need to travel to North Bay or to Huntsville. So we are continuing to monitor demand and offer clinics, at least right now, on a weekly basis, and we will continue to do that until the need is determined to not be there.
Thank you. This next question is for Louise. It is from Sarah Cook from the Parry Sound North Star. Why isn't the outbreak in Nipissing First Nation listed under the Outbreaks tab in the new dashboard?
Thanks, Sarah. Outbreaks in First Nations communities are managed by the communities themselves, and any reporting or updates that are provided on these outbreaks are provided by the communities themselves. Dr. Chirico, is there anything you wanted to add to that?
Just that we support the First Nations in any efforts that they require, that we need to support them in managing their outbreaks. So we work with them, but they are the lead in their community outbreaks, and we offer assistance whenever they need it.
Thank you. Our next question is for Andrea. It comes from Jennifer from the Nugget. Have you had to close clinics or pivot because you don't have enough vaccine?
At this point in time, Jennifer, no, we have not had to close a clinic, cancel a clinic, or make any changes to our existing clinics. We are trying to plan our clinics based on the allocations that we're receiving, and so we've been very fortunate that we've not had to do that.
Thank you. Our next question is also for Andrea. It's from Brad from Moose FM. We've heard that the West Nipissing vaccination site is ready to be moved to the neighboring area of Marcel Noel Hall. Do you know when that will be made official? What's the reason behind the move?
Currently, the clinics in West Nipissing are being held in the Marcel Noel Hall, but in order to accommodate a larger volume of people, we're moving it next door into the arena. That was the plan all along. The community feels it's the right time now to move from the smaller hall into the larger hall, and so that's what's happening. I believe the change will occur next week. This week, I believe we're still in the Marcel Noel Hall, and then beginning next week, we'll be in the on the 23rd, we'll be in the arena setup.
Thank you. Our next question is for Louise. It comes from Eric Thompson. An individual at Our Lady of Sorrows was recently found to have been at school during their infectious period. Has there been any challenges in reaching high-risk contacts now that everyone has gone on break? And if any more cases are found, will an outbreak be declared at the school even though they're moving to online learning with the rest of the province?
Thanks, Eric, for that question. It hasn't been too challenging. We have a great relationship with our school boards and schools, and in this particular instance, we were able to connect with the school straight away and start our usual process. We notify publicly through a PSA, and as well the school notifies their school community as well. So there hasn't been any challenges to date with respect to following up with people. If we did have an additional case which was determined to have an epidemiological link to this particular case, even though we're moving to online learning, yes, we would still be in a position to declare an outbreak.
Thank you. Our next question is for Dr. Chirico. It comes from Tom from Radio Works Parry Sound. Would the health unit not benefit from getting the AstraZeneca vaccine information directly from pharmacies as part of better notifying the community in the event of issues, or keep track of those vaccinated?
Yes, we are working to get communication centrally through the government, and have asked for exactly that, a mechanism so that we are able to monitor and track, and that's currently being developed.
I can add to that too. The pharmacies are also using the same database that we are to document the immunizations that are being given across their sector within the province as well. So all of the immunizations are being put into a central database.
Thank you. Our next question is from Louise. It comes from Chris Dawson from Bay Today. Do you support more school testing measures if students return to school?
So the schools already have in place their asymptomatic testing process. And as a parent, you would have received a notice about this through your school and through your school board, and letting you know about the sites that are available for asymptomatic testing. I also am aware that the school boards recommended going into April break that the asymptomatic testing be used by families, particularly, and teachers, particularly if they were considering traveling outside of the district, which we would not be recommending given that we're in a stay-at-home order. And so that service will continue to be in place, even with online learning, and should be used appropriately, and when if individuals feel that they have been potentially exposed to someone who is a case.
Thank you. Our next question is for Dr. Chirico. It's from Eric Thompson. You keep emphasizing the need for individuals to follow health unit guidelines and stay home, but people do not need to work to live. But do people not need to work to live? Are there any specific policies you think our government could put in place that would help keep people at home and safe?
Well, I think that you raised two issues. One are the public health measures and what people need to do to stay home, but work is essential as well. So if one of the policies that we have in place and one of the things that we recommend is that if you can work from home, work at home. It's the safest to do that. And if you have to work outside of the home, businesses have been preparing for a long time and have many things in place to help protect their workers. So with that, we know that that would be the safest scenario. As far as what we can do at home to protect people, if that's the question that I understand, I think that with what's been outlined as far as the public health measures go now, that if people use really good judgment and only go out when they absolutely essentially have to, and especially when they go out for exercising, again, it's good judgment. You can do it. It's far safer being outside, but in areas that you can physically distance and that you are wearing face covering when appropriate, for sure. But people know what causes the virus to spread. They know that it's with close contact. It's when you aren't adhering to the 2 meters, when you're not wearing a face covering, and or if you go to work when you're ill or having symptoms. All those things are what's going to really cause the virus to spread in the community. So I don't think there's anything extra at this time that needs to be put in place. If people would just adhere to what is being asked of them now, we can get this under control. And we proved that we could do it. We did it in the first wave, and we slowed the curve, and we prevented a lot of people from getting sick at the same time. And we didn't overrun our healthcare system, especially in our district. So we need to do the same.
Thank you. Our next question is for Louise. It comes from Sarah Cook from the Parry Sound North Star. Does the health unit think that there is a possibility schools could be closed until September?
Hi, Sarah. At this point in time, I can't answer that question. The province has not provided a time frame with their communication. So anything is possible, but right now there is no time frame on it.
And I'd like to further add to that, Louise, in that, again, the quickest way to get the schools reopening is to adhere to the public health measures and keep the spread low and turn this around. And it has to happen throughout the whole province. So everybody has to play a role in it. And when we reduce the numbers, when we see things coming back down to normal, that's when we will have the best chance of getting the schools open before the summer.
Thank you. So that is all of the submitted questions. So that will conclude our press conference for today. The recording will be available on our website, and we will see you back next week on Thursday at 10 a.m. Thank you.